Hi there! This is Dr. Gülnar Maharamova from Baku, Azerbaijan. In this video, I will demonstrate the complete range of Medesy endo instruments and how versatile, comfortable and useful they are in day-to-day working. I have had the chance to use them for last few months now. This case video was shot over 2 appointments. A young lady, 21 years old, complained of a severe night pain on her upper left jaw. Upon investigation, we revealed a deep caries cavity and the reversible pulpitis diagnosis was confirmed. We started the procedure with local anesthesia and rubber dam isolation. You may see stainless steel clamps of different designs and tools to make isolation easy and comfortable for both a patient and a doctor. Using dental operating microscope and rhodium-plated mirror, all the demineralized dentinal tissues were removed and the access cavity was performed. Next step was to localize root canals orifices by means of endodontic probe by Medesy. It is thin-tipped and perfect for this procedure. I proceeded with root canals orifice shaping. The working lengths of both palatal and buccal root canals were determined by means of electronic apex locator and measured by means of an accurate ruler, which is easy to disinfect and precise. Each step of root canal preparation is followed by copious irrigation with 5.25% sodium hypochlorite solution. When shaping was over, we proceeded with final irrigation and drying the canal space to make it ready for the obturation. The remnants of sealer and gutta percha were removed by cotton pellets soaked in ethanol. A piece of Teflon is placed to close the cavity and the temporary filling was placed till the next appointment. To make the treatment easy, efficient and accurate, we used Medesy tools throughout the whole procedure. I hope this demonstration was helpful and insightful for you as it was for me to showcase. I highly recommend these endodontic instruments for specialist endodontists, general dentists, and students. Thank you!